Present with us, Level 1 Councillor of the Municipal Health Commission, Madam Wu Qianyu, Deputy DG of the Municipal Big Data Center, Mr. Zhu Junwei, VP of the JD Group, Mr. Wang Wenbo, and Senior VP of Ele.me, Mr. Xiao Shuixian. First of all, the floor is yours, Madam Wu. Friends of the media, good morning. As of yesterday, we newly reported confirmed cases 1,006 and asymptomatic cases locally transmitted 23,937. And among the newly added confirmed cases, 228 confirmed cases are discovered in the quarantine population, and the rest discovered through the risk population screening. And 191 were previously categorized as asymptomatic carriers. Among the newly added asymptomatic cases, 23,412 asymptomatic cases are discovered in the quarantine population and 525 discovered through the risk population screening. 517 newly discovered confirmed cases are male cases. According to the districts, in Pudong, 517, Huangpu has 101, Minhang District has 88, Xuhui District has 44 cases, Jingshan District has 44, Baoshan District has 36, Yangpu District has 32, Chaoning District has 26, Jing'an District has 25, Putuo District has 24, Jiading District has 21, Fengxian District has 13, Hongkou District has 12, Songjiang District has 10, Qingpu District has 9, and Chongming District has 4 cases. Combined with their epidemiological records, clinical symptoms, lab test result, and imaging results, the above-mentioned 106 cases are diagnosed as mild cases of confirmed COVID-19 cases. And as to the newly added asymptomatic cases of 23,937, they are also diagnosed according to the procedure, and you can have more information on our website. As of 9 a.m. of today, we have in total investigated close contacts 226,000, among which 180,000 people have already received a negative test of nucleic acid test. And for the close contacts of the close contacts, we have investigated more than 110,000. They're all put into our area of observation. And we have also covered all of them with the nucleic acid test. We have already received the results of the majority of them. As of yesterday, we have discharged some people from the hospital and also put people out of medical observation to the number of more than 10,000. As to this group of people, the destination communities should receive them because they are already discharged or they are released from the medical observation, and they have to collaborate with the authorities with the follow-up measures and observation at household level. Currently, we come to a critical moment of the fight against COVID-19. According to the work arrangement and also based on several rounds of nucleic acid tests at city level, we will continue with our efforts, and judging by the newly released results of the nucleic acid test, we will have this layered management system, and according to the level of the seriousness of the COVID-19 containment, we have 3 levels of categorization of the districts. Yesterday, the Deputy Mayor has also introduced to all of us the details about the 3-tiered management system. We should not lower our guards. We have to try our best to cut off the chains of transmission at the community level. So that is all I have for today. during the briefing. Thank you very much. Now the floor is open for your questions. Please first identify yourself before raising the questions. Thank you. Line number 7, please. Thank you very much. With the Economic Daily, I have a question for the representative from the Municipal Big Data Center. Recently, Shanghai has put into use the code for nucleic acid test. What is new about this service? And some of the people, they have run into difficulties. For example, sometimes the system is not that stable, and some elderly persons, they don't know how to use the system. And how can you handle all those concerns for the people? Thank you very much for this question. This service is a new type of service that has attracted so much attention from the society, especially when we are launching another new round of nucleic acid tests at citywide level. We have the registration code for the health cloud in the past, and as to this new code for the nucleic acid test, it will facilitate people's login. And once registered in the system, you can repeatedly use it. You can also have a digital screenshot. You can also print it out. And another characteristic of this code is that it applies the same standard as the code to go. We also have the other important functions with the code to go, and now this time with the new version of service, you can have this combination of services. Yesterday we launched this new service of the nucleic acid code for the first day, and before the massive launch, we have collaborated with the telecom services to send textiles to people to help them to better acquire the knowledge of using this code. For example, we tell people how to make a screenshot of this code, and those telecommunication companies, they are supportive. In a short period of time, there's significant increase of visitors to this platform. At peak hour, we have a total volume of visitors of more than 2 million per minute. So for a single visit of this huge volume, you can imagine how hard it is for the system to cope with that. And sometimes that explains why people can witness the breakdown of the system. And it's the first time for us to apply such a service. We have to put it under challenge, and once we have discovered this problem, we have optimized and extended the capacity of the system. After 2 p.m. of yesterday, we have restored this service online. And for this nucleic acid test service, you can have access to this code through the other channels. For example, the Tencent and Alipay system. We have quickly repaired the system yesterday afternoon, and during the utilization, for sure this temporary breakdown of the system has caused some worries to the people, but in the future, I promise to all of you that we will continue to improve our services with this platform. We have also considered some scenarios of the day-to-day use. Considering those challenges, we have come up with some new iterations of our services. For example, for the younger generation and also for the elderly population, we have come up with a simplified versions of this code. For the elderly persons, they can use the offline code. So with this simplified version of the code, they can also get themselves registered during their registration at the spot of nucleic acid test. And for the foreigners, they cannot use this code. For our side, we allow the registration by the foreigners by using their real names. If indeed for the foreigners you cannot apply for this code, then you can also take your passport or the other identity document to the spot of nucleic acid test. We have prepared a lot of versions of the work arrangement so that we guarantee that everyone can have their nucleic acid test run. We will try our best to improve the whole system of services and also give all the people an equal access to our service platforms. This is the goal of our work on a daily basis, and we also hope that people can show us their understandings and collaboration. Thank you very much. Next question, please. Line number 13, please. Thank you. I have a question for JD Group. People today, they need daily necessities, and for example, for the infants, they also need their milk powders. Can we make sure that we can deliver all those daily necessities and food to people's doorstep as soon as possible? Thank you very much. I'm the person in charge for the Eastern China region, and in recent days, people have a lot of concerns for their access to the daily necessities, for example, the food. For example, people are worried that they cannot have the channel to buy those daily necessities like the food and the other drugs, medicines, and the other food of emergency. We have strengthened our supply chain for the access to the daily necessities. We have designated vehicles for the delivery of the infants related goods, the diapers, the milk powders, etc., as well as the other COVID-19 containment necessities. We deliver all those goods to the doorsteps of the people, and we have also designated a batch of the milk powder and the other food and necessities for the infants to the hospitals of children. For the makeshift hospital designated for young children, we have also equipped them with an extra batch of food and necessities as of yesterday. We have received 37 pieces of messages coming from ordinary people asking for help. We have collaborated with all the chain stores in order to meet people's demands. At the same time, for the fresh goods, the meat, vegetables, fruit, and seafood, we can see that we have a significant increase of the demand for these foods, and this food supply would also be increasing to cover the demand that is 2 to 3 times bigger than usual. And people also have some worries and concerns about the deliveries. While respecting the rules and regulations for the COVID-19 containment, we will try our best to use our own logistic teams so that we can deliver all the goods to your doorsteps as soon as possible. We have mobilized more than 2,000 delivery persons to guarantee our rapid food delivery to the citizens living in Shanghai. We also have the non-contact services of deliveries. For example, we have the self-driven vehicles that are based on the latest generation of technologies. We will try our best to contribute to the containment of COVID-19. For example, for the delivery and storage and the other chains of services, we have combined all those units. We have checked all the codes of the delivery vehicles, and we have disinfected all the corners of the workplaces. We have made sure that all our workers working on the front line, they are protected. And for our delivery persons, they are checked every day with an antigen test. We have the closed loop of management, and we make sure that we have designated drivers for each designated vehicle. Currently, JD Group has joined the citywide guarantee system. We are an enterprise based on the technologies. We will shoulder our social responsibility, and based on our special advantage of the logistics and deliveries, we will do our best to join this COVID-19 containment and guarantee of daily necessities for the people. Line number 11, please. Thank you. I'm with Wenhui Journal. I have a question for the Municipal Health Commission. Now it's been a long time for people to stay at home during the lockdown period. Do you have extra tips for the people? Thank you very much for this question. Recently, the COVID-19 containment situation is under tension in Shanghai. A lot of measures are taking place at the level of communities, for example, nucleic acid tests, antigen tests, as well as the guarantee of the good order during these procedures, and also we have the delivery of the goods. It's a very important thing to guarantee that all the people involved during those procedures can stay in good health status. For the major scenarios, I'd like to give you some extra tips. First of all, the first scenario, during the nucleic acid test, please make sure, as mentioned before, wear your mask and make sure that you respect the social distancing rule of 2 meters. Please avoid unnecessary talks and communication with the others. Please don't touch the suspicious goods and materials. If you come to the nucleic acid test, you have to follow the rules, and the community have to make sure that you do the nucleic acid test group after group and avoid unnecessary massive crowding. And if you complete your nucleic acid test, please put your mask back and go back home as soon as possible. And second, when you go out and pick up your goods delivered by the groups, as is mentioned by the representative from the JD Group, it's very important to do this work in a non-contact manner. When you pick up your goods, you have to wear the gloves and also your mask. On the surface of the goods you just received, please do the disinfection job, and after a while, you can pick the goods, and you also have to remember that you have to wash your hands very carefully for the workers and also the volunteers at the community level. If you go to pick up the antigen samples and if you deliver the goods to the doorsteps, for example, today people, they are handing out the paper baskets outside their door, for example, with the doorknobs. You have to wait until those delivery persons leave for a while that you can go out and pick your goods up. And the third scenario is that for the volunteers working at community level, you have to make sure that all these persons are trained before they reach their post of work. Because we are witnessing an increasing number of volunteers working at this level, so we have to make sure that they know how to wear correctly the protective gowns and they know all the important tips before joining the work. They also have to be taught the important instructions, for example, how to wear and take off the protective gowns for volunteers working at different sites. According to the levels of the protections, they have to protect themselves and equip themselves with all the materials. We have also noticed that the volunteers, they are doing a great job and they are more familiar with their job. And with the post from the WeChat moment, some of the volunteers, they have shared with their relatives and friends their experience of the daily work. When they put on their protective gowns, which are used for the separation of the virus, some of them, they are taking off part of the protective gowns in order to have dinner or have lunch. So that is not a correct way. If you need to have the food, then you have to make sure that first of all you take off the protective gown completely and in a very correct way. The taking off and also the putting on of the protective gowns is a very important thing for you to remember. Only by following the correct procedure can you best protect yourself and also your family members. We also hope that all the medics and the people, our citizens, you can protect yourselves and also you can stay safe while respecting the social distancing rules. Next question, please. Line number 12, please. Thank you very much. I'm with the Xinmin Evening Post. I have a question for the group of Eleme. For the citizens still living in the lockdown area, what kind of emergency services can we offer to these people above mentioned? Eleme has been created in Shanghai City. We are fully engaged in the guarantee of daily necessities for the citizens in this municipality. We have, for example, over the past week, increased the capacity of delivery persons of a number of 2,800. We would like to solve the problem of the last kilometer during the delivery of the food. Our whole group has also collaborated with the other groups, for example, with the Hema Fresh and the Darenfa supermarket. Every day would add an extra of 1,000 tons of fresh vegetables and food and fresh goods. And for our group, we have this delivery teams to share the food with the people, especially the elderly persons living in the seniors' house. We have already restored the services of the delivery persons, moving forward according to the new policies and regulations for the COVID-19 containment. For the different areas, for example, the lockdown area, the controlled areas, and also the prevention areas, we will collaborate with the restaurants and also grocery stores and factories while reassuring our own safety. We can also maximize our services of deliveries to the doorsteps. For the special population, we also have the emergency response services. For example, the elderly population, people suffering from the chronic diseases, and the infants. Timely daily life services is our edge of services. Overnight, we have mobilized our units of work. We have set up a specialized team composed of 200 people. They will pick up the phone calls with the hotline. We will also call back to know the following up development. As of yesterday, more than 40,000 pieces of information have been settled. Today on the streets of Shanghai, you can see designated vehicles from our group to deliver the goods for infants, for elderly population, and for people suffering from chronic diseases. We give the priority to those people, those special group of population. In the future, we will try to maximize the special working group to solve the most urgent demand of our citizens. Talking about the supply of the medicine, since 28th of March, our platform has delivered more than 1 million units of deliveries. In recent days, there's a significant rise in the demand for medicines. We have established our contacts and communications with more than 1,000 pharmacies and units of medicines. We give the medicines to the people so that they can cope with some emergencies. This will also continue to be one of the major tasks of ours, because now we arrive at a critical moment. It's not very hard for people to visit a hospital. So if they can have some medicine in reserve, it can soothe their life. Today, people are also enjoying the access to the online consultation. They can order the medicine online and offline. There will be the delivery services offered by our site. At the same time, in order to increase the efficiency of the delivery, we have the group purchasing realized at the level of the communities. We have the group command of the food at community levels from Yangpu District, Putuo District, etc. We also have the retail commandings. At community levels, we have already covered more than 23,000 households from the Pudong District. For example, we help them with the group commanding of the dairy product, eggs, and meat. In the future, we are about to expand the coverage of the service model. At this critical moment of our fight against the COVID-19, the delivery men of our Ele.me group, they are working very hard to cover more people and deliver services to more households. Sometimes they even don't have time for themselves to take a bite. At the same time, on our platform, we discover that we cannot respond to the requirements of some customers in a timely manner. But we are convinced that with the coordinated efforts of the municipal authorities and many other enterprises, we can finally put an end to this fight against the COVID-19 and we can win the battle. Thank you very much. The very last question for today. Line number 2, please. Thank you. I'm from the International Television from the CMG. I have a question for Municipal Big Data Center. In recent days, we have gradually restored the supply of the food on online platforms. How can we better use the big data to serve this fight against the COVID-19, especially for the COVID-19 containment in different sites? Thank you very much for this question. Once we can stabilize the containment of COVID-19, there are more and more real business come back into service. How can we ensure a permanent application of measures against COVID-19? Based on the code to go, we have added more codes. For example, the guardians of health online. We have different models of services. People can just choose one of them that suits them best. You can visit also the portal site of Shanghai municipality. You can download the applications and the code. Once downloaded, the codes can also be printed out. So when you go out and visit this public place, you can show this code, whether by a real-time check with your mobile phone, or you can scan the code by the WeChat or Alipay app, and you can get yourself registered before your entrance into the public spaces. We also have another facility called the Digital Guardians for Health. So when you visit some public spaces, the gateways, for example, and some other poles for the scanning of the codes, you can get your code to go to be scanned, and then you will get yourself registered before entering into those spaces. This can significantly facilitate our containment work against the COVID-19. If there is a regional or a spot-related outbreak of COVID-19, then immediately we can use this digital guardians of health to trace back to all the people related. Today, we are digitalizing all the services and also our fight against the COVID-19. Recently, we have accelerated the application of the digital guardians for health as well as the public space-related codes. These measures would facilitate the most rapid restoration of the services. Thank you very much. That is the end of today's Q&A session. If you have more questions to ask, please contact our information office. We will also make you